we'll start. Okay.
All right, you are dispatched to a residential area, well-kept home, for an ill person.
Ill person.
That's all you're told.
So,
The wife leads you back to the bedroom.
scene safety, BSI, number of patients. One mechanism of injury, we're about to find that out. Additional resources, we'll call for lift assist, just to, consider ALS, I am ALS, so.
You is, that's right.
And consider C-spine.
All right,
And then
very good.
we'll consider that once we figure out. So we are in the back, wife takes us
To the bedroom?
to the
Yep.
patient is.
And there he's laying in the bed.
In the bed.
In the bed.
Okay, so at the doorway, like, am I just seeing this?
Mhm.
Complexion, like skin tone, what am I seeing?
He looks a little pale.
A little pale before I walk in. Does he track us coming in the room?
Sure does.
Okay.
Yep.
Good morning, sir.
Oh, yeah.
My name is Delano, paramedic. What's going on?
Oh, I've been sick for the past 3 days. My stomach hurts really, really bad. I'm vomiting, throwing up. Looks like blood.
Okay. So, like, does he have like any like buckets or anything in the
He
room?
does. He has a little bucket on the bedside stand.
Like, if I have my partner like look at it, or if I look at it?
It's dark brown, coffee-like,
Okay.
maybe about 4 or 5 cups.
Okay. Said past 3 days you've been vomiting, so I checked his pulse.
I was sick for like 3 days. I
It
started
feels
vomiting yesterday.
a little fast and weak.
A little faster. Weak.
Right.
Vomiting. Okay. So first off, airway's clear. He's talking.
Mm-hmm.
Patient's alert.
He is.
Because he tracked us coming in and he responded to our, to us talking to him. And he is breathing. I have a partner that's there,
Sure.
correct? Alright, so I'd have like my partner start setting out to check oxygen saturation, but he's pale, so.
So he's doing that.
So nausea, vomiting, do you have abdominal pain with that?
Oh, yeah.
Okay, where's your
So
abdominal
bad.
pain?
It's kind of everywhere, but I mean, it's up in here, then it goes straight down in here.
Do you have back pain with that as well?
No, it's just here in my stomach and my lower area, I guess.
Okay, so I'm just gonna lightly palpate his abdomen on this far side, so it hurts everywhere I push?
Oh, more there in the center, for sure.
How about on this side?
Yeah, a little bit there, girl. On my liver, I got problems with my liver.
Okay. Okay. Any difficulty breathing?
No.
Okay.
No.
Alright. No massive external hemorrhage at this time.
No.
We checked his pulse, so he has a good pulse. His circulation is,
It's fast and weak.
yep, but he has decent, as far as we can determine at this point, the circulation's okay.
Yes.
And then no difficulty breathing.
No.
And then, so he's bleeding and he has something going on where he's bleeding either like in the stomach or it's his esophagus because it's coffee ground type blood. It's been going on for 3 days more or less, so he's dehydrated. Are we up steps?
Are you up steps?
Like,
No,
are
this
we-
is a ranch style home.
Okay.
Just back a hallway.
Okay, so, I'd like to at least, I'd like to place IVs, for this patient. Get IV in place and consider fluid administration, but I'm going to go for history take. We'll go onset, so the onset was the last 3 days. Provocation, was there anything you were doing when it started?
No, I was out, and my belly started hurting, or my stomach started hurting, and I started taking ibuprofen yesterday. Not yesterday, the day before, and I probably shouldn't have done that.
Okay, how much ibuprofen have you been taking?
Just whatever it says on the bottle, like 2 every like 6 hours or 8
Okay.
hours.
Okay, so you've been taking
Not
it.
a lot, just, but it wasn't helping.
And how would you describe the pain?
It's kind of there all the time, but when I try and get up, it gets really, really awful. I mean, it actually gets better when I throw up or I poop.
Okay.
But I wanted to go to the ER, and so I tried to get up on my own day, and I felt like I was gonna pass out. Well, I knew I was gonna pass out, I got dizzy and the room was swimming, and I just laid back down, and my wife called for you guys.
Okay. And the pain, it's just in the abdomen, does it radiate anywhere else?
No, it's just all around in here.
Okay. And, 3 days ago was a rough time. Alright. And then history, you said you have liver problems?
Yeah, I have an alcoholic liver disease.
Okay.
I have some cirrhosis from, I was an alcoholic years ago.
Okay.
I've been clean for 3 years.
Congratulations.
And, yeah, and I haven't touched anything, but, you know, I knew I had problems with my liver, and that caused me to get diabetes.
Okay.
And some other things too, but I was told I shouldn't take
Okay.
ibuprofen. I
Yeah.
did, I didn't have anything else.
What other medications do you take?
I take insulin for my diabetes. I take Indoor for my blood pressure and my heart. I take Lasix and and potassium. I take the little white pills on your tongue, just nitroglycerin.
Nitro?
I haven't taken any of that, but I have.
You haven't been experiencing chest pain?
No,
Okay.
they just gave it to me, because I had this bout of chest pain last year, but it turned out to be just an angina, I guess. And I take aspirin.
Okay.
I take an aspirin every day, and I probably should have taken the ibuprofen, that's why I'm.
Are you allergic to any medication?
Yeah, sulfa and, bee stings.
Okay. Alright. So, while I'll be talking, kind of assess his legs real quick. Like pedal pulses, any swelling, am I noticing any
No
swelling?
swelling, the pulses are present, fast, and weak.
Okay. And then, at this point, me and my partner will get a full set of vitals.
All right.
So, he's diabetic, so I definitely wanna get a blood sugar.
Okay.
Wanna get a pressure, O2 saturation, and respiratory rate and quality.
Are you ready?
Yes.
All right, you said blood sugar, it's 132. Pulse is 120, regular and weak. Sinus tach on the monitor. Pressure is 80/60. Respirations are 24, not labored. Saturation's 97 on room air. CO2 is 35.
So I'd say he's a priority transport.
Okay.
So we want, hopefully lift assistance here at this time. But we want to package and get him to the back of the ambulance.
How are you gonna do that in a comfortable way? Cause he's having a lot of pain in his belly.
So, ideally, if this is like a ranch style house, we'd be able to get the stretcher all the way into the bed. That is the most ideal.
Give that a try, sure.
If we can't do that, we wanna keep him in a position of comfort, so supine is this is how I find him tracked.
Mhm.
So this is his apparent position of
Okay.
comfort.
Sounds good.
So we can use a reuse or like a scoop stretcher to kind of scoop him up and
I love
carry him
scoop
out.
stretchers.
Yeah.
Okay, you're in the ambulance.
So, so I already have the IV in place on scene, so I wanna start him on a fluid bolus.
So it was running how?
Um,
KVO or?
no, we do it wide open at this time, so a 500 fluid bolus, we'll do it as a 500 fluid challenge, and we'll reassess after the 500.
You have almost 500 in now.
And
Okay.
so we reassess.
Pressure's up to like 92,
Right?
pulse is the same.
Okay. I did respiratory rate and quality, but I didn't do lung sound, so do deep breath for me. One more time. Right under here.
Lungs are clear
So-
bilateral.
Say that again?
Clear bilateral.
Okay, so we can hang another 500 back.
Okay.
And then we'll do that, not wide open, but like halfway. We don't have to get him to like 120, but we'll keep him in the mid to upper 90s. That's the ideal goal. If I didn't mention to put him on oxygen, we'll just put him on a nasal cannula at 2 liters for now.
Okay.
So he's not reading hypoxic, however, he's bleeding internally. It's unclear how much blood he's lost, so his blood volume is probably low. No nausea. Are you nauseous or vomiting? Or are you nauseous right now?
Yeah, I'm nauseated.
Okay.
Nauseated or sick in my stomach, it's pain. I haven't vomited since, maybe, I don't know, an hour ago, right before you guys got here.
Okay. If you'd like, I can give you some Zofran for the nausea. But if you think you could tolerate it, we can. How far is the hospital from us?
You're about 15 minutes from a local hospital, 25 from a trauma center.
15 from like what level is my local hospital? Like
It's not terrible, but it's not a trauma center, it's no specialty center.
it's no specialty center.
I mean, if it's gonna help the pain or help me not feel so sick,
Okay,
I mean,
but-
sure, I mean,
So,
yeah.
so yeah, I can administer you, so we'll administer, Zofran, so.
How much?
4 milligrams IV,
Okay?
and we'll see how that helps you, and then we'll set 30 minutes from the.
You're 20 minutes from the hospital, 20, or whatever.
15 from the local
25 from
hospital,
trauma center.
25 from the
Yeah.
trauma center.
Okay. What is mine for the trauma center? Ideally, it's within 40 minutes, and I can keep the patient stable enough for the 25-minute transport. And depending on so he most likely, because of his liver problems, has esophageal varices. Or like a tear in his esophagus, so he may need surgery. So ideally, that would be the best place for him for definitive care. So that's where we want to take him. And then we'll transport and continue to reassess.
Okay. Give me a verbal report, if you would, please. You're about 10 minutes out.
10 minutes. I didn't get. How old are you, my friend?
I'm 63.
Can I get a current vitals, or is everything more or less?
Just what I gave you, they're consistent.
So we're up to the 92 with the fluid.
Right.
Can I redo the blood pressure real quick?
It is 92 over, we'll go with 74.
Respiratory rate is still the same?
Yes.
Okay, everything else is still the same, okay. So, calling in notification, we have a.
Medical command, go ahead.
63-year-old male presenting with nausea, vomiting, coffee grounds, hematemesis?
Are you hematemesis?
Hematemesis.
Okay, yeah.
Has been, initial onset over the past 3 days. Patient does have a history of, liver disease, and current vitals are tachy at 120, sinus tachycardia at 120, last blood sugar is 132, respiratory rate is 24 unlabored, O2 saturation, room air is 97, we have him on 2 liters, for comfort measures, capno is 35. And we will be there in 10 minutes. IV established, 500, however much fluid I've administered at this point, and Zofran administered for the nausea.
Very good. Okay, we'll see you when you get here. Okay. May I stop your recording, or?
Yeah,
you wanna?
the
Is there anything you would do differently?